Hello and welcome to Sick Notes. My name's Dr. Ed Hope, and a big thank you to all of you supporters because this week we hit 50,000 subscribers. My mind is blown. Thank you so much. And if you haven't subscribed and you want to learn more about medicine in simple terms, then why not join our ever-growing family on YouTube? This week I celebrated by hanging out with our channel's favourite GP, Dr. Lizzie Tuckwell, to answer some more of the web's most searched questions. Thank you for joining us. I'm back again. I've been at my giant Googling computer and we have Dr. Lizzie with us again.
Thank you for having me.
So, as always, we look at the most common things that people are Googling and try and give our insight into what it's all about, what are they asking, and so people never need to answer these questions again. Today,
do doctors? Right, do you want to pull the first one off?
okay,
Fantastic.
do doctors do home visits? Well, from working in A&E, we don't do home visits. We have the ambulance service to do our home visits. But as a GP,
Yes, so I do a home visit pretty much every day. In the community, we have people that can't get to the surgery, so they're housebound, normally sort of older people or with quite complex needs, or if they've got cancer and they're undergoing sort of chemotherapy and it's not safe for them to go out and sort of mingle, we'll have to do a home visit for them. But it's not what I'd call routine, it's only if there's sort of a specific need for it, so quite a sort of acute problem, and for those people that can't get to the surgery.
and I guess, do you do palliative care stuff
Yeah,
as well?
do lots of palliative care stuff. So we liaise with the palliative care team, and sometimes they'll go in and do things, but we often will have to go as an emergency to give some medication, sometimes injections, sometimes just to do a general review, and then we'll liaise with the district nurses and things like that. So as a GP, whilst most of the work is done in the surgery, we're part of what's called a multidisciplinary team, and we all work together, and home visits are often the culmination of one of those.
Very good. Yeah, because when I worked in palliative care for a little bit, the juniors wouldn't, but the consultants would do a lot of home visits and making sure everything was all right. But that steps over to GP as well. Any other specialties that do home visits?
When I did psychiatry, we used to do quite a lot of home visits.
Of course.
In most sort of psychiatry jobs, there's what's called a home treatment team. So they will go into patients' homes, make sure they're okay. And the idea with all of this is sort of to prevent someone going into hospital.
Do you ever dread them?
How to answer that tactfully? Sometimes there are difficult home visits, but in fact the more difficult ones are the ones that you actually need to do. So if someone's having a problem, so if they're hoarding, if their hygiene's not very good, that's often reflected in their home. When I used to do a little bit of dementia work, the home visits were pretty much vital because someone will come to your clinic and they'll put a lot of effort in, quite understandably, very presentable, sort of tell you almost a tale about how well they're doing. It's not until you go to their home and open the fridge and there's nothing in there and there's stuff all over the place. So
Gotcha.
It is a really important part of our job. See what this is. Do doctors smoke? I don't smoke.
I don't smoke.
I know people that do smoke.
Exactly. I think as doctors, we're more likely to have alcohol problems, but actually we're less likely to smoke.
Yeah.
So that probably just shows how bad smoking is for you.
Yeah.
That we're happy to sort of take the risk of alcohol, but when it comes to smoking, we don't see any kind of thing with it.
I think we don't have time to smoke.
Yeah, right, exactly.
When you're running around the hospital,
Or
there's
can't
no
afford
such
to
thing.
smoke.
Yeah.
Nowadays.
I don't know how anyone affords it. Okay.
Do doctors take an oath? UK.
Ooh, I wonder if there's a difference.
Did you ever take an oath?
No, I didn't. I know some medical schools, I think they do.
Really?
Yeah.
I never knew that.
But I personally haven't taken an oath. The sort of, and when we talk about an oath, I'm going to get really geeky here, and I did bring something with me. This is a little book here, the writings of a certain Hippocrates.
Oh, very, like the forefather of medicine.
I did a history of medicine degree, so I know quite a lot about Hippocrates. I went on holiday just so that I could see where he was born. That is the full geekiness that I have. So he wrote an oath back in Greek times of what the duties of a doctor would be. Some of it translates to these days, some of it doesn't. And in olden days, they would swear to that oath. And the god of medicine, Escapists, was sort of above Hippocrates in that.
That's where we get that symbol.
Exactly, the staff
rod.
and the
Yeah.
snake. Nowadays, though, whilst we don't sort of swear to the oath, those same principles of patient care, quality of care, making sure that you make the right decision for the patient and not put yourself in the way of that your sort of needs above the patient's, are translated into, in the UK, our GMC guidelines. So
Absolutely.
whilst we don't swear an oath, we do sort of commit to good and best practice as outlined by the GMC.
Exactly, and I guess on top of that as well, maybe like the hospital, what the hospital
Yeah.
stands for, and in some ways, like the law in the UK.
Yes.
So kind of all of those things together. But I think, in a way, I think at med school they instill a lot of these principles without you really looking them up.
No.
And then you hear that they're underpinned by these values.
Yeah, and I'm sure it's the same with sort of a lot of professions. It's all about sort of being professional and nice.
Professional and nice. Let's do it.
Okay, next one. Oh, the same one.
Oh, right.
But I wonder in America if they, do you
okay.
reckon they have to take an oath? I don't know. Maybe our followers would tell
Maybe,
us.
we'll find out.
Do doctors still use pages? Our faces might have given that away. Unfortunately, yes, we do use pages.
Do you like using pages?
I hate using pages.
Really? But the thing is, I can see why you'd think, why are they still using such an old school piece of gear? But actually, their simplicity is why
It works.
they're good.
Yeah.
Because the nurses don't have to, or whoever wants to bleep the doctor, doesn't have to type in a message. They just type in who they want to contact and the number they want to get contacted back on. So you can just explain exactly what it is straight away. So the doctor themselves can kind of triage their jobs they're doing. But I did hear that in the hospital that I work at, there was a shortage of pages. And we tried, did you hear about this?
No.
And they tried to get hold of more pages, but the firm that made them said that they can't get hold of any more because they need to grow some crystals.
That sounds a bit dodgy, doesn't it?
But it sounds like they're powered off like some Lord of the
Kryptonite.
Rings, Lord of the Rings technology. But I think it's true.
Well, they're pretty much indestructible. I think if
They
you speak
are.
to most junior doctors, they've dropped them down the loo and thrown them downstairs and all that sort
You
of
can't
thing.
say the same if we had iPhones.
No, I know
you
some
go.
places do use iPhones, but you're right. The simplicity of the bleep, as we call the pages, it does its job. It does give me a bit of PTSD though when you're at the supermarket and they're checking out, and your heart just jumps a little bit when you hear that bleep. And that's even now I've been sort of out of the hospital. I don't have one in GP land, but yeah, still get that heart beating.
Yeah, I know the feeling. Next up.
Do doctors have doctors? This comes back a little bit to what we talked about GMC actually. Yes, we do have doctors because it's not right or ethical that we treat ourselves or our close friends.
I think there's a bit of a habit where we kind of feel like we're indestructible.
Yeah.
There's that. Some people they have that culture where they feel like because we see so much illness that it won't really happen to us. We are supposed to have like a GP that we see with any issues rather than sort of having our close friends that we work with.
Do doctors have a PhD?
I don't have a PhD.
I don't have a PhD.
Next. No. Some people do though.
Yeah.
Some specialties, it's you pretty much to become a consultant really have to have done some kind of research, whether
Yeah.
it be a full-on PhD or not. So certainly like cardiology and neurology, they tend to be, I know the consultants here have all done PhDs and things like that. But certainly not, I mean, we kind of stole the name doctor, didn't we? The
Yeah.
title doctor from the people that actually used to have an academic and research background. So in a way, when people say to doctors, oh, you're a proper doctor, it's like we're not the proper doctors.
The others are.
Exactly. Do doctors call with bad news? I've telephoned people when it's been absolutely, no other way of doing it.
Any sort of big sort of diagnosis or information that you have to give, you have to be really careful how you do it. Most of the time I wouldn't give bad news over the telephone. There are times when you have to. For example, if a patient asks you, so quite often if I've done an investigation and it's come back and I'm worried that someone might have cancer or something that we need to look in for, I'm not going to just sort of ask a receptionist to ring at some point in the week. That's my clinical responsibility and I will ring that patient. Normally I'll just say, can you please come in and make an appointment? We'll discuss it there, and that's fine, and most patients kind of get that. That's called signposting. That's something we're going to talk about, something important. Other patients will be on the phone, no, tell me straight, doctor, what is it? So on those occasions I have.
You kind of get used to delivering bad news, don't you?
Yeah, it's never nice, and you sort of develop a sort of, I guess, a shell to protect yourself. And again, that sort of links back to us having codes of contact and having doctors for ourselves, because when you're having to deliver sort of bad news all the time, it can't help but sort of eat away at you a little bit.
In certain cancer specialties, so there's a lung cancer clinic where one morning they'll be doing that every other patient.
Yeah.
I don't know how they do that. Do doctors get drug tested? Presumably this is for recreational drugs rather than performance enhancing.
I'm not an elite athlete.
I was thinking coming into exams.
Maybe.
That person's done so well, you must be on something. I've never heard of anyone getting drug tested.
Again, I only think the time that we might get drug tested is if we had a problems with substance misuse.
Do you reckon they'd force you to do it?
I think it might be part of your sort of return
Yeah.
to work, maybe part of your sort of occupational health or something from the GMC, just to make sure that you're fit to work. But I don't think it's definitely not routine.
But I would probably say that whenever you have problems like that, it's kind of, as long as you highlight them beforehand, they may deem it necessary to sort of suspend you as a doctor. But it would, if any kind of testing wouldn't be, it would really be about making sure that you're on the right track.
Yeah.
Once you've made that initial thing, it would be about supporting you back to work rather than trying to catch you out with anything like that.
Okay.
Last one. Actually, you can do it.
Oh, okay.
We'll edit that bit so it looks just seamless.
Do doctors get ill more often?
Do you get ill more often?
From
Now, before med school?
I think it changes. So when you get to a new patient population, I think you perhaps you pick up on their germs. So when I first started GP, I sort of got a cold a couple of times, which is unlike me. And when I was on paediatrics, I also did.
Really?
Yeah.
Okay. You would think
Yeah.
that we get ill more often because, using the sort of germ theory that way spreads, you'd think we get ill all the time.
Yeah. But I think we sort of build sort of an immune system response to it, I think. And I think that's why sort of when I found that I've moved hospitals, it's a new batch of germs, a new community of germs, so sometimes you might get hit. One of my colleagues, when I said, I've got a cold again, she goes, when you start GP, you get a spike, then you're fine again. So, but I think that's just anecdotal.
But also in hospital, like obviously we're supposed to wash our hands,
Oh, yeah.
Wear scrubs in certain places. So, in theory, we're supposed to mitigate that type of thing. I think from my point of view, I was ill a lot at med school, just randomly. I wasn't trying to bunk off exams. But as being a doctor 3 years, not had a day off sick.
That's pretty
It's
impressive.
pretty good, isn't it?
Yeah.
So either I'm running on pure, as soon as I rest one day, I'm just going to get every illness under the sun. But certainly for me, on our one sample, it's all good.
Or you're not working hard enough.
So we've answered all these questions again, smashed it out. Dr. Lizzie, thank you so much again. We'll do some more. We'll do some more. Guys, thank you so much for checking out all the videos and all the comments as well. How funny are the comments?
We love the comments.
More comments, please, and we'll be back soon. Thanks again, and bye.
Yeah.